Welcome to the Dose of Optimism, where I talk to the optimists in healthcare. My name is Omkar, and I work at one of the world's best children's hospitals, where I lead innovation. I started KidsX, which is a premier international startup accelerator for pediatric innovation. And over the years, I've met thousands of startups, investors, and innovators. Every one of them has a story, and every one of them is optimistic about the problems they're solving. On this podcast, you'll meet amazing people who will share their stories and what makes them optimistic about the future of healthcare. A little note before you get into this episode. This podcast is for informational purposes only. We are not offering medical advice, and we're not endorsing any products. Please talk to your own physician about your health or the health of your children. All right, let's get started. We talk a lot about optimism on our show. Recently, I read that the CEO of an organization sometimes has to act like the chief executive optimist for their company. In this chaotic and transformative time for children's hospitals, I thought it would be interesting to talk to the CEO of a children's hospital. So, I sat down with the CEO of the hospital where I work, Children's Hospital Los Angeles, and Paul Viviano. He has been our CEO since 2015. He was previously the CEO at UC San Diego Health System, USC's hospital, and many other health systems in Southern California. When it comes to learning about leading academic health systems, Paul is a great place to start. We talked about his beloved LA Dodgers and the lessons he gleans from team sports, like baseball and football. We talked about the current state of pediatric healthcare and the headwinds blowing strongly right now. And we talk about the future and what makes him optimistic. I hope you'll enjoy my conversation with Paul. Thank you, Paul, for joining us.
It's a pleasure to join you, Omkar. Thanks for the invitation.
Paul, I've known for you to be a Dodgers fan for many years, and they've had many great years in the last little bit, but it's been a journey for them to get here. And I like to sometimes think about lessons that we can take from things outside of healthcare, right? So as a Dodgers or a sports fan, are there any lessons from their journey that perhaps you can apply to leadership and management?
Well, I think there's always a lot of takeaways, and team sports is a good place to draw upon. And so while it is true that the Dodgers the last 10 years or so have had a great run, before that, there were a lot of heartache and a lot of heartbreak. But beside that, I do think that the creation of a complementary team that the Dodgers have been able to cobble together, kind of a combination of youth and experienced players that they don't have all the same skills. They have different skills. They have a team, and that is applicable to healthcare leadership, to pediatric healthcare, to the work that we do, and the perseverance that goes into it. As a baseball season's long, it lasts for months, and a lot of games and a lot of travel, and it's hard. And so the perseverance of working hard and staying focused on goals, you work through the slumps and enjoy it when you're in a winning streak. So I do think that perseverance, especially in today's environment, the focus, the hard work, the determination, while at the same time experiencing the joy, is a great takeaway as you look at successful professional sports teams or collegiate sport teams.
That's really interesting. Taking that one step further, they assemble this great team, including some acquisitions, a team that's got a lot of expectations. Do you think a team that has high expectations, perhaps the same as a hospital that has a top 10 ranking, the pressure is higher, right, to perform? And does that make it harder to lead?
But I think the pressures that go along with those high expectations can be a motivating factor. You don't want to be the first Dodger team to not win the division title or not make the playoffs, right? So you don't want to be the hospital that loses a ranking. It's meaningful. So in a lot of ways, it's motivating in a positive way, but it does add pressure, and leadership's a pressure cooker. I mean, there's no way around it. For baseball, the box scores in the paper and the standings are there every day, and it's easy to see. So that pressure, I think, it's like the joke about competition. Competition makes you better. The pressure makes you better.
It's funny, I'm a New York Giants fan, so different sport, but similar concept. There's a pressure cooker there with that media market. And
Sure.
despite the talent, I think they've struggled for many years to have the right leadership in place and to have the right talent that can not only perform on the field, but also deal with that extra pressure of being in New York versus, let's say, Jacksonville or Green Bay or some other place.
It's the art and science of leadership. I'm going to have a complementary team. I'm going to focus on goals, and we're going to be detail oriented, and we're going to focus on the right things and drive performance. And, sometimes with the wrong leadership or the wrong approach, it doesn't work. There are lessons there about coaching. You look at Dave Roberts and how he handles these highly paid superstars, how he handles the less experienced players that don't demand these outrageous sums of money. How do you blend all that together into a team? You've got superstars and you have to have a team. Just like the Dodgers, and hopefully for the sake of your New York Giants, you have to be great at everything. Your
Yeah.
offensive line has to be great, and your defense has to be great, and your special teams have to be great.
Yeah.
How do you blend all that together in a way that's team-like? People make sacrifices for the overall good of the team. I'm going to sacrifice my batting average to make sure I get on base or steal bases or do whatever I need to make the team win, as opposed to looking at my statistics individually. That oftentimes is a breakdown in leadership. Everybody wants to win. For organizations that are more complex, like healthcare organizations, health systems, academic medical centers, children's hospitals, et cetera, the places that you see that are successful, in my estimation, is where you see alignment. You see alignment from the board to executive leadership, to faculty, to nurses, to the community, to volunteers, around a mission, around the areas of focus. And where you see organizations struggle is where expectations of certain constituents aren't aligned with others. And that can put pressures on leaders that are not manageable. And so the creation of a strategic plan, a set of initiatives driven by your mission, aligning around that becomes so centrally important to your success. And again, it's easy if you're the New York Giants. You want to win 12 games and you want to go to playoffs or whatever the goal is. In healthcare, it's far more varied, it's far more complex.
Let's use that to transition to pediatrics. Children's hospitals right now are facing unprecedented pressures from workforce shortages to financial constraints, complex care, reimbursements, not what it used to be. You're the CEO of top children's hospital. How would you describe the pressures that we're facing today and what we'll face 2026 and beyond?
It seems like the headwinds are everywhere, like coming from every single direction. You've referenced them, from workforce shortages where you don't have enough critical care nurses, you don't have enough pediatric subspecialists. You can name the challenge in the area that we refer to as reimbursements under enormous pressure. I think the thing that makes it even more complicated right now is there's a lot of uncertainty around what will the federal support be for Medicaid, which is so centrally important to all children's hospitals. How will various states react to federal funding that may be variable? How do you improve quality and outcomes and performance when you have a workforce that perhaps is less trained than it has been historically? Expectations of patients and families are greater. You've got patients and families in our circumstance where we see increases in incivility incidents. So a lot of pressures, from a lot of regulatory pressures. And so how do you forge a way forward in the midst of all that? But, in this era of uncertainty and volatility, it's hard to have a long-term plan. And I think that's a challenge for all of us who like to think beyond just tomorrow and like to think about 2 to 3 years, 5 years, whatever that reasonable horizon is, kind of going forward. Today, it's really difficult to do that. And so I think you've seen the horizon of leaders kind of contract by necessity, not by preference. So investments have a shorter horizon for return. How much do you invest in your workforce? How much do you invest in research? How much do you invest in expansion today? Not knowing what the reimbursement environment, the primary headwind that we're facing today, how do you make long-term investments? It's a real challenge for us today.
You talk about research, and in the last year, I think there's been a lot of pressure for research. I think a lot of research historically across the country has been funded by federal dollars. There's changes in terms of how that's happening, and it's been well documented. What are some ideas that you and your peers are thinking about for the future of research in terms of how it could be funded? Are we going to go back to a world where federal dollars are where we can count on for research, or are there other opportunities?
Diversifying your research revenue portfolio is always a good thing to consider. It does have a double-edged sword. So many of the alternatives to federal funding don't pay for indirect costs, or do so at a very, very skinny rate. And so that becomes a bit challenging. It's like everything else in healthcare, and especially so in pediatrics. If you're not at scale, it's going to be a hard road going forward. And so you do have to look at it like a portfolio, some blending of federal funding with whatever the indirect overhead rate might be. A lot of pressure there, probably combined with some industry, some pharma. And then for many children's hospitals are opportunities for philanthropic support. So I think you're going to see a lot of donors funding research efforts to sustain the great research organizations that do exist in children's healthcare today at many great children's hospitals, because the other sources are variable and uncertain. So I think that's one way people will fill the gap. And, you have to be realistic. The donor pool is only so big. And if we get a gift for research today, we may not get a research for a clinical program. A little bit of a trade-off.
Paul, you've always been a really big advocate for equity and equitable access to care for children. Children's Hospital Los Angeles is a safety net hospital, and proudly so. As you look across the country for pediatric care, how equitable is care across the country? And how far do we have to go to make sure the kids have access to what they need?
There's kind of like 50 different answers. Each state kind of varies. California is an example of the eligibility criteria for Medi-Cal is relatively generous or very generous, depending upon your perspective. What gets covered is exceptionally generous, and many families and children are covered via the Medi-Cal program. Much of the funding is federal. Other states, they have different perspective. It's harder to be eligible for Medicaid. They cover fewer things. You do see disparities, and we see disparities in our own community as well, based upon poverty levels and income levels and access to care. I know as a group, the children's hospitals in the country are very committed to improving access and to addressing inequities in healthcare in many communities. That requires partners. The hospital is not big enough to address housing and challenges and food insecurity and unavailability of healthy alternatives, availability of medications, and I can go on and on. But there is a very substantial commitment. But I think in this era of so much pressure on Medicaid reductions, HR1 kind of being the poster child, 15 million people roughly are going to lose Medicaid coverage nationally, is the current thinking and analysis would indicate. That's going to create greater disparities and greater inequities in access to healthcare. And while we're committed to making sure we do everything we can in our community, it's a problem that's bigger than us. So we have to have partners. And we have to have partners that are like-minded to try to help address those things. We'll help lead it, but it's a complicated equation.
Every time I tell people that nearly 40 some odd percent of Medicaid recipients are children, they're surprised nationally how much of the Medicaid population and covered lives are children. I think people imagine a different population when they think about what Medicaid covers. And I think they're surprised to realize how much reliance there is for children's health on Medicaid.
A lot of ways you cite 40% of all the people in Medicaid are children. About 20% of all the Medicaid expenditures is for children. That's where the disparity starts. And you look at a county like LA, not too atypical for many major metropolitan areas, and about 55% of all the children who reside in LA County are on Medi-Cal. The most recent market share data reflects that in LA County, about 70% of all the children who were hospitalized in LA County last year were on Medi-Cal. And so that speaks volumes about the status of healthcare. And the fact is about HR1, it really wasn't a public policy debate about the value of Medicaid. That wasn't the debate. There was some noise around it, but it really was a bill designed around taxes and tax extensions and other things that were unrelated to healthcare. Medicaid just happened to be the source of funding for these other things. Not saying those other things are important or unimportant, but the point is that there really wasn't an explanation or a debate about what is the impact of cutting $1 trillion out of Medicaid over the next 10 years. What will that do to the status of public health, access to healthcare, impact on children, future generations? I can go on, but there really wasn't a debate about that.
Let's pivot a little bit. Some say that a CEO is the chief executive optimist. You've got to provide optimism to your organization, especially during challenging times. We've talked about how this year and the past few years have been challenging in pediatrics. What makes you optimistic about the future, Paul?
It is part of our leadership responsibility to lead with hope and to lead with optimism. People want to follow an optimistic leader and want to have hope for their organization, for the work that they do, for the careers that they've devoted their lives to. And so I'm excited about a lot of things about our future. I'm excited about how to improve access to healthcare. So I'm optimistic about the continuation of new treatments, new medications, gene therapy, cell therapy, the things that we're involved in here at Children's Hospital Los Angeles, where a child had 10 years ago, zero chance to survive a specific disease. Now there are treatments and medications and gene therapy treatments, cell therapy treatments, et cetera, that have a high likelihood of success. And it's true, while they may be expensive, the outcomes have been spectacular. I'm excited about the embracing of our needs by the philanthropic community. It's always inspiring to see how generous people are when they have the opportunity to learn about the impact that children's hospitals have, our hospital has in this community. And so we get embraced by a lot of people in our community that are grateful for the work that we do and do everything they can to kind of support it. I'm very optimistic about the future, as challenging as the headwinds are. And I think articulating that balance, you have to acknowledge that it's a challenging set of circumstances that we all face. And miracles happen literally every day at Children's Hospital Los Angeles. Patients survive things that they weren't surviving 5 years ago or 10 years ago. And so those miracles, that impact on the community, on families, great source of gratification, great source of excitement, enthusiasm, optimism. We're creating hope. And the joy that comes with that has to be kind of top of mind because the excitement about the impact that we're having on tomorrow is so bright.
Thank you for joining us and appreciate all that you're doing to lead not only CHLA, but also pediatric healthcare across the country. For a child in a hospital, a book is more than just pages. It's a window to the outside world. A book provides optimism that there will be a future beyond their illness and their hospital stay. At CHLA, a program called Literally Healing is helping children use books as a tool to heal and regain normalcy with childhood. I sit down with Kyle Horne to learn more about this inspiring program. Kyle, thank you for joining us.
Thank you so much for having me.
Kyle, what is the Literally Healing program at CHLA and what inspired its creation?
We gift a free book to every single kid who's at the hospital every day they're there. So that means we're gifting over 80,000 books a year. But I always like to zoom out when I'm asked that question. And in a corny way, what we do is we create hope and build healthier futures. And the reason I say that is that's the CHLA mission. And so often people think of Literally Healing as this kind of aside to the mission of what the hospital does. But I actually think we're directly aligned with it. And I like to give a couple examples. So when I break down that mission into like create hope and build healthier futures, for me, when we're thinking about creating hope, think about a first-time parent. You've just spent 9 months being excited, getting ready for your first child. You dream of the first time they cry, dream of maybe their first diaper change, but dread the 500th. You imagine their giggles, their first steps, all the birthdays that you'll celebrate. But all of a sudden your life's turned upside down. Your reality is shifted and you're in, let's say, the NICU. And having a book like The Little Engine That Could might just be the medicine that you need to be able to help you keep going. Or if, let's say, you're a 6-year-old, you have a cancer diagnosis, understanding what that is at that age, or honestly at any age, is really difficult. You might need a book like When a Kid Like Me Fights Cancer, or if you're their 8-year-old brother, you might need a book like How Do You Care for a Very Sick Bear? It breaks it down at that kind of developmental level. But then in reality, when you're that age, what you feel like you probably need is some laughter and giggles. So you might need the book with no pictures or Grumpy Monkey. At night, mom and dad might want to read you Guess How Much I Love You. Like these are all just intrinsically important to being a kid and to being hopeful for what that future is once you're out of the hospital. And that's our goal when a kid comes here is we want to get them healthy and well and back out and living their life. And so that's kind of the create hope side, and the build healthier future sides for me is and I'm sure we'll talk about this, but it's the idea of getting kids access to books who otherwise wouldn't have access. So books can provide such an important opportunity for kids and their development and their growth. And so many kids don't have books in their house, let alone an overflowing bookshelf. That was something I didn't realize was a privilege growing up, was books were something my parents didn't say no to. And so that's something that we're really trying to help change, is shifting that definition of what it means to be able to have books in your house. And for me, that's building a healthier future for our families through the literacy space.
You've got some stats on this, Kyle, in terms of books in households. It's surprising how books are a luxury to a lot of families in this country.
It really is. The data that sits around this space is that if you're in a middle income family, you have on average about 13 age appropriate books per kid. If you're in a low income neighborhood, there is one book for every 300 children. So when you look at that in perspective, what that means is in a middle income community, for every 300 children, there's going to be 3,900 books. But in a low income neighborhood, there's only one book for those same 300 children. It's just such a huge discrepancy. And when you think about it, it's not just the ability to buy the books. That is such a huge part of it. It's also the fact that if you need to get to the library, where a lot of our libraries are having to reduce hours, or it can just be really difficult to get there. You might have to take one or two different buses, and that's not a reality for some people. So it's a sad fact that books, which are just this wonderful, beautiful, imaginative journey kids get to go on, aren't as readily available.
A lot of these kids are from low income communities. So a lot of these kids may not be receiving books or getting books at all, perhaps in the year. And so this may be something that's incredibly special for them.
When you think about CHLA and the patients that we serve, we're so fortunate to be able to serve the Los Angeles community in the way that we do. And for CHLA to invest in a program like Literally Healing really just shows the dedication to thinking of the child as a whole child and not just thinking about what is that diagnosis that brought them here, but how do we make sure that they're healthy and well when they're in their community, they have access to the material that they need to develop and grow and be a normal kid.
So I love that we're giving kids books. I can see how that's making an impact, especially given kind of the book deserts that are out there in low income communities. But you started by talking about books that are custom oriented from a topic or thematic standpoint based on the child's diagnosis or what they're going through. So, how does that work? How did we get there and why is that special?
We have two different sides of our program. We have our recreational library and then our therapeutic library. So on the recreational side, that's the books like when I was talking about the book with no picture, Grumpy Monkey, Day the Crayons Quit, all those really fun, joyful
Great book, by
books.
the way.
The books, yeah, I know. Those are the books that are going to bring joy, laughter, distraction. Like that's a huge part of what we do. And that's the day to day when people think of Literally Healing, that's usually what comes to mind because that's where we have the most touch points across the organization. The other part that you were talking about, which is a really unique offering, is our Chase Therapeutic Library. And that's a collection of books that we review. So we have a group of clinicians, they meet every week, and we review therapeutic books that range on topics. So we say that it's topics that are going to deal with really difficult diagnoses, prognoses, procedures, associated feelings, and then adverse childhood experiences, our ACEs. So when we're thinking about that, we're looking at books and how it might explain both like cancer diagnosis to a kid, but then also the emotional coping that comes with that. And so these are books that we really want to make sure we're doing quality over quantity. And we find that quite often, like a book might be written by a doctor and it's medically correct, but it doesn't maybe necessarily touch in on what needs to be in a book to make it engaging and interesting. Or you have someone who maybe experienced going through a medical situation and they know how to write a book, but they maybe don't have accurate medical information. So often the quality of the therapeutic books that exist in the market sometimes are bad and sometimes can actually be dangerous.
So, for example, I can go on Amazon and look through reviews, and would that be the same as what you're doing? You had shared with me an example years ago about a book that I think had some great Amazon reviews, but when
Yeah.
you all looked at it, there were some themes in there that perhaps were not appropriate.
One of the big things with that is you can so easily ask your friends and family to go on and buy a copy of your book and then do a review. And I almost get nervous when a book only has 5-star reviews. If they have anywhere from 6 to 50 reviews and they're all 5-star, I get really worried. And You can get an idea of what books exist out there. There's definitely books that have 1,000 reviews, and you can see a much wider breadth of what people think. But we really found that there's a lot of books that don't quite meet the quality that you expect. And yeah, and that book that you're speaking about is one that when I think about like dangerous topics, like that one comes to mind. But then there's other ones that are really small. Like I can think of this one book where everything in the book was really great. But the whole point of the book was to reduce fear around shots, like needles. And when they showed the needle, they had the kid as this tiny kid, and they were trying to explain what the needle looked like. But they made the needle like 5 times as big as the kid. And it took up like the entire page. And we just went, oh no, this entire great book was ruined essentially on this one page because the whole point is to reduce fear, but that's just going to instill fear. We're trying to be really thoughtful. We have an entire algorithm in terms of how we rank and rate and score the books when we're going through them.
Yeah, I mean, ultimately, it's the parent that's writing the review on Amazon or any online website, and not necessarily the child who may not voice that, oh my gosh, that needle looked so big. And that actually
Yeah.
made me more scared. You said you meet regularly with this committee that looks at books. What are some of the types of things that people bring up? What are other types of things that come up as you think about the pros and cons of different books that could be in a therapeutic library?
So we have it sectioned out. And for example, some of the areas that we're looking at is we're saying illustration is one of them. And within illustration, we then have it broken down into different segments, both quality. Is it modern in terms of what like a kid today would be interested in reading? Is it inclusive of the diversity of patients that we have? And then also we're thinking about, is it medically and clinically accurate? Those, depending on the topic, that can be viewed slightly differently. So we break that down specifically as well. And then we're also looking at story. Is it telling a story that will be engaging and interesting? And then we're looking at what's the background of the author? Does the author have the knowledge to be able to write this book? And we do have both a lived experience component as well as an educational and like job experience component because we want to give weight to both. If you've lived it for a long time, like we have parents who are incredibly knowledgeable on what their children are going through. So we definitely don't discount that is considered when we're reviewing the books.
I'm going to read something to you. Corny coronavirus has been traveling the world. He shows up on the doorstep of a child with a suitcase and the ability to spread germs everywhere. During the pandemic, I thank you because I was able to read Careless Corny to my kids, and it was really helpful for them to understand a little bit more about COVID and coronavirus during a really challenging time, and one in which there were not a lot of books on the market because it was so new. So you co-authored a book. Tell us about Careless Corny.
Yeah, so Careless Corny was a really fun book. We realized when we were first stepping into COVID-19 and figuring out what that reality was, we were trying to find books. And we found that books typically were written in one of two ways. Like they were written by people who were really knowledgeable on what COVID was and kids weren't interested. And so it's just too medical, or they're written by people who maybe didn't have the clinical background to understand how to break it down. So we brought together a child life specialist, an art therapist who's a marriage and family therapist, and then myself on the literacy side. And then our artist was also an art therapist as well. And so we just had this really engaging team come together and say, we want to make sure it's fun and engaging for the kid. It's not fear-based, but we try and break down some of these big topics. Actually, day one, we called one of our really good friends, Drew DeWalt, who wrote Day the Crayons Quit and a whole bunch of other amazing books. And I said, hey, Drew, we're wanting to work on this. Would you be able to like give us some pointers? Could we send you over a draft? And he was like, do you want me to write a draft? And we were like, we're not asking for that, but sure. And he literally stayed up all night. I talked to him at 10 p.m. and he called me at 5:30 a.m. and he said, all right, Kyle, I have a draft. Let me send it over to you. And this is what I love about Drew is he sent over this draft. It was incredible. It was really great, but it was like a superhero approach. And we were trying to avoid that. We wanted it to be very much like any kid and every kid. And so when we came back to him and we had notes for this like New York Times bestselling author, and afterwards he goes, Kyle, I feel like we have different visions. I'm going to support you in whatever way you want, but I think we just have different visions on this. And it was just the most amazing story, but we're still dear friends and he's written books for CHLA as well.
Yeah, I was going to talk about high juice box in a second, but the Day the Crayons Quit is a irregular request from my girls, and it's a fun story. So let's fast forward a little bit. Tell us about High Juice Box, because that's another great story. And I think you teamed up with a Disney animator on that one too, right?
Yeah, we did. So we started with Drew on that because Drew actually, just to say, what an incredible human. And also, just to back up, one thing didn't mention, and I have to, is the Literally Healing team, which for us includes both like the team, the staff, but as well as our volunteers are what make the program special. So we can give away the books, we can do all of that. But without our volunteers who are going bedside and reading and engaging, and our team members who are providing these incredible storytime events, Literally Healing just wouldn't have that spark.
Let me add to that. So there's three components to it from what I can tell, and correct me if I'm wrong. You walk in, there's a beautiful library of books, and it's very child friendly and designed for kids. It feels like a dream library for kids. And it's got all these books that you're describing. I imagine there's both therapeutic and recreational books in there.
Yeah, we have the therapeutic books behind closed doors because we always
Gotcha.
partner with a clinician when providing those books.
Gotcha. That makes sense. And so then you've got that beautiful space, and then you've also got these volunteers that are walking around the hospital, delivering books to kids as part of the program. And then you've got this great program down on the main lobby level of our hospital where you've got people who get to read stories from your library to kids that are waiting for maybe a doctor's appointment or waiting to get their lab done or whatever they're waiting for. Maybe it's even siblings of kids who are here. I've had the privilege of getting to read to some of the kids, and it's some of the best memories I have working at CHLA. It's a lot of fun, and it's great because the kids are engaged. It's a way to have some sense of normalcy. Anyway, back to the juice box story.
A big part within all of those moving pieces are these volunteers. Drew initially came to one of our daily events in our outpatient area that you were talking about, those story times. We do weekly events in our inpatient reading room, which is kind of like our big Cadillac story time event, Stories Under the Stars. And then we do an annual event, which is Children's Book Week. We bring a whole bunch of authors on site, like all the top Southern California authors who happen to be available that day, volunteer their time. We get all their books and they sign books, they take pictures with kids. It's a lot of fun. So that's where we initially engaged Drew. From there, he said, "Hey, I actually do this on a regular basis." So we brought him in through our volunteer program, and he came in weekly. He had the blue CHLA volunteer apron on. He would put together a cart of books of a whole bunch of different authors, and he would go around room to room and read with kids. We had a special stock of his books as well, so he could obviously read and sign those for the kids too. It was incredible. He was coming every week, and he drove a long way to be here. And his schedule started getting really busy. He said, "I still want to give back, but I'm traveling so much now. I don't think I can come every week. What else can I do?" And I said, "Hey, so in our therapeutic space, we're recognizing these topics that don't currently have books, and we're wanting to create those resources. Would you be interested in partnering on that?" And he went, "Oh my gosh, yes." So he dove in headfirst, volunteered his time completely. And the one requirement he had was that no one who was involved in it could make money off of it. And I was like, we can get behind that. So yeah, he wrote the book and he was wanting to illustrate, but once again, his schedule was so busy. And so we brought in this other incredible partner, Benson Shum, who has volunteered also at the same book week event. And so he came in and he provided the illustrations and really just brought Juice Box to life. And so, yeah, it's this book about a juice box who gets squeezed too tight in an accident and then has to come into the hospital and has to go through different appointments with doctors and physical therapists and meets all of kind of the key players within a pediatric hospital and then goes through PT. And one of the big things we wanted with this book is a lot of the books that talk about coming to a hospital say, "I broke my arm, I went to the hospital, I got an x-ray, a scan, surgery, a cast, I said goodbye, I went home, and in 2 weeks I'm playing soccer again." And that's not the reality for a lot of our patients. We have a lot of patients who are here long term who have illnesses that are going to impact them throughout the rest of their lives or long term in their childhood. And so we wanted a book that was reflective of that, that was really reflective of the fact that sometimes when you come to the hospital, it might be a bigger part of your life, and that's scary and it's hard. And we want to recognize that and acknowledge that and try and make it a little less scary for those kids who are going to go through that.
So if parents out there are interested in the book, they can download it online, or also there's ways to get free copies to this book, right?
Yes, yeah. So it's free. That was one of the things Drew required. So it's on our website in both English and Spanish as a downloadable PDF. So if you're in a school, whether you're in America or halfway around the world, you can download it. It's also being recorded, and then we're in the midst of translating it into a number of other languages as well. So the hope is that ultimately we'll have it in a number of languages that'll be downloadable and easy to enjoy.
It's a great book
And
for
then
those of you who are taking your kids to the hospital. It's a great way to just explain what that looks like and what that experience may feel like to a child.
And then just one other thing to add into it for anyone who's either in the healthcare space or in the literacy space or anything like that, if you're actually wanting to print this out professionally, it's one of the other things that Drew and CHLA agreed on. We're going to provide the files for professional printing for free. So if anyone wants to have it printed where it looks like an actual book, because that's how we provide it. If you want that, CHLA provides that to anyone for free. You just have to reach out to Literally Healing. You can learn more at chla.org/literally healing. Our email address is on there. You literally just email and they'll be able to help support that.
We'll put it in the show notes for this episode. So, Kyle, before we let you go, our podcast is called A Dose of Optimism. You've done a lot in the world of literacy, of leveraging books for both therapeutic and recreational enjoyment for kids who are going through hospital settings. What makes you optimistic as we think about the future?
So many different things. I think sometimes it can be hard to feel optimistic in certain moments. And I tell you what, I have a friend who said, I don't know how you work in a pediatric hospital. Like, you're around kids who are sick all the time. It must be really hard and really sad. What I think people forget is, like, kids are the most optimistic of all of us. They're the most forward thinking of all of us. They're the ones who, they're not at the hospital typically thinking, woe is me. They're thinking like, woo, I want to get out and play on that playground. Like, when does the playroom open? When is the reading room open? They want to engage and get better. And for me, being with the kids and with the patients is really where I find my dose of optimism. And, in times that can be really difficult, and you just see the joy and determination that they bring. And often when they can find that through a book, the moments when we've had a kid who's in a really bad space. I remember a story. We had a patient who thought he was going home for Christmas, and it was, do this test, you'll be home for Christmas. Do this procedure, you'll be home for Christmas. And I went in a couple days before Christmas, and I could hear him crying down the hallway. And I asked the nurse what was happening. And she said, unfortunately, he's got some tests back that are pretty bad, and he's going to be here a little bit longer, like a month. And so I went in, and obviously he's understandably upset. And we had our favorite book, the book with no pictures. And I said, hey, bud, do we want to read it? It's okay if you don't, but, and through tears, he was like, yes. So we read the book once, and by the end of the book, he was like drying his tears. He says, again, we read it again, and he started giggling and laughing. And by the third time we read it, he was like, read the next page, standing on your head. And it was just this moment where seeing a child being a child, a book bringing out that joy, was just so full of incredible optimism. And about a month ago, I was walking through the hospital and I saw him. I saw his mom. I haven't seen him in maybe 8 years. And I literally was holding back tears because it was just so incredible to see this kid who I know what he went through, and to see him like up and walking and joyful. And he told me he was like going to soccer practice afterwards. And I asked him what his favorite book was. And just to see these kids go through so much and come out the other end so incredibly resilient provides so much optimism to me.
You're making a huge impact, Kyle. You and your team. Let me know when I can come back and read to the kids. Kyle Horne, thank you so much. Appreciate the work you're doing, and thanks for coming on the show.
Thank you. Appreciate it.
All right. Thank you for joining us for your dose of optimism. Make sure to check out our show notes to get more information about our guests and the work they're doing. Visit our podcast page on the KidsX website to join our podcast community and to learn more about pediatric innovation. Thank you to our sponsors and to our presenting partner, KidsX. Please subscribe wherever you get your podcasts, and remember, it takes a village to make sure our kids grow into healthy adults. So volunteer at your local library, help out at the community center, and thank your crossing guard. And if you're so inspired, donate to your local children's hospital. All right, see you next time. The content, views, opinions, and information presented on this podcast do not reflect the views of Children's Hospital Los Angeles or of the sponsors of the podcast. CHLA does not endorse the views, opinions, and information presented on this podcast, and CHLA specifically disclaims any legal liability or responsibility for the podcast content.